How do you see the rise of cardiology patients in Nepal in the current years? Because you are trained there for now more than 25 years in the practice.
Yeah.
So how do you see rising patients?
This is where earlier also, but the dynamics of management had changed. Previously, when MI or we say heart attack occurs, then admit in CCU and then give medicines and see the outcome. But the recent trend is when there is acute event, then you try to open up the culprit vessel, and sometimes most of the cases, if patient come in time and we do intervention in time, almost it's a physiology is established and patient remains normal. Means long-term outcome and the dynamics of cardiac physiology has changed a lot.
Welcome to HELLODOC. Today, the word is so much engraved into various types of diseases, problems, and everybody is running around doctors, medical colleges, nursing homes. But still, the people are not getting what they want. And that is why the medical fraternity has a very important role. So, ARYA Pharma Lab brings in this program what actually the doctors are going to offer to the common man. That is our motto in this program of HELLODOC. So, every week we will be coming out with one doctor who will be with whom we will be discussing on how he is going to serve the society. So today with me is Dr. Raj Kumar Thapa, a leading clinician from Nepal, and we will start with his journey in the medical profession, and then we will continue our discussion on various other topics. So, sir, this is one of the noble profession also which you have entered, and one of the most difficult profession also. So, how you started your journey into this profession, and what are the challenges you face, what are the struggles you faced, and then what is the future you see?
Yeah, thank you. I'm presently I'm an interventional cardiologist. I started my journey from since 1997, and I started my career from College of Medical Sciences, Bharatpur, which is it was from the very beginning. I was the second batch. Now, uh, talking about Nepal, they started first DM, cardio and neuro, and now this is and my institute is one of the leading medical institute in Nepal. Actually, the path of being a doctor is not so easy. From the very beginning of my school, we used to we have the means deep insight and motivational as well as aim of becoming a doctor. I started MBBS, then did after that I joined Army, Nepal Army. Then from there I did MD Medicine from National Academy of Medical Sciences, Bir Hospital. Then it continued. Now it's almost 25 years, and I tried being means the initial goal was to become a surgeon. Later on, I became a physician. Still, then with time and my aim, I tried to become a cardiologist. I did my postgraduate from John Hopkins, USA. Then still the journey was not fulfilled. So my field of intervention, I entered in 2023. I did intervention from Singapore, National Arts Center, Singapore, which is one of the best in Southeast Asia. Sometimes it is even taken as the best cardiology center in the world also. one of the best, one of the best. I don't say he's number one, but one of the best cardiology center, and I'm proud on that. Still, now I am much more involved in my daily works, but it's quite sometimes hectic sometimes, but I still enjoy. The what I see is the journey is not simple, but we have to keep on trying. And the first thing is we need to be clear on our goal, and we need to enjoy what we do. Then slowly means something we may not get it immediate, but time will give.
So, sir, one thing you said that enjoy what you do.
Yeah.
But as a clinician, sir, many times you are not able to balance between work and life, and many times you see you are going for some party and emergency has come. So, how do you manage all these work-life balance situations?
Yeah. For this, I think the family support, and especially the support of the wife means your partner is the utmost importance. Otherwise, you can't sail the boat. Sometimes frustrating also, but we have to come out of it. But when we are, it's actually some sort of uh,
So, as you said, sir, family support is
yeah,
very
utmost
much
important.
important in this scenario. और आप तो दिलों का सही रिश्ता रख रहे हैं सर
Yeah.
जो है तो दिल से दिल का रिश्ता मजबूत करना है सर. So one thing is more like you said here, you are interventional cardiologist. How do you see the rise of cardiology patients in Nepal in the current years? Because you are trained there for more than 25 years in the practice, sir. So how do you see rising patient?
Yeah. One thing is maybe the cases were earlier also, but the dynamics of management had changed. Previously, when MI or we say heart attack occurs, then admit in CCU and then give medicines and see the outcome. But the recent trend is when there is acute event, then you try to open up at the culprit vessel, and sometimes most of the cases if patient come in time and we do intervention in time, almost it's a physiology is established, and patient remains normal. Means long term outcome and the dynamics of cardiac physiology has changed a lot. The management means previously the intervention aspect was very nominal, and it was it's not the history is not long, but within the past few decades it has grown up, and it's emerging. Every day new things are coming up, and better understanding of the cardiac physiology, and better management. It's actually the in intervention, it's the fusion of sophisticated engineering and medical science. Means the engineering aspect, they create lot of they have with the medical science they have fused means the instruments, and in the expert hand that works better, and the totally the patient dynamics had changed and disease dynamics had changed. That is the
Because,
difference.
sir, when you would have started, there were not so many of diagnostic
Yeah.
tools. But today, a lot of diagnostic tools have come. So, how do you feel whether they have actually helped you out in diagnosing the patients? Or many times it is also said that matlab, many diagnostic tools are used only just to have use it. So, what is your opinion whether they have helped you in the diagnosis and treating your patients better?
Yeah. Actually, before doing any interventions, the strategy and the actually the what is the problem. If we don't understand the problem well, your management might differ, and uh, rather than it is helpful, that maybe other way around. So actually, proper diagnosis, and the proper strategic way of management, it gives actually benefit to the patient. Otherwise, sometimes it is harmful. So definitely, the recent development of diagnostic tools in diagnosis has utmost importance.
And sir, do you see a rise of cardiovascular problems or metabolic problems in the youth also?
Yeah, definitely, it's a global issue because of our lifestyle, our dietary habit, and stress, uh, sleep, then risk factors like obesity, then again smoking, diabetes, dyslipidemia, and all those, and the increase of population. So definitely we have to balance in between, and the preventive aspect is the modification of the risk factors. Then and then again this actual intervention is the when the problem occurs, then we are there. And again, if problem occurs, then the management aspect has improved the long term morbidity and mortality of the patient.
So, what message you would like to give to your to society or your patients or your relatives through this podcast, that what they should do and what they should not do?
Yeah, actually, we have to take care of our risk factors, and then we have to take means from lifestyle modification to our what we can modify.
So, as you said, sir, lifestyle modification is one of
Yeah.
the most important things. I think people who will listen to you, and maybe if they will follow your advice,
Yeah.
maybe they will be better now.
Always in medical science and wherever, prevention is better than cure. Try to prevent it sometimes, but sometimes everything is not preventable. Still, there are family factors and all the genetic factors. Even though we may gain weight and everything, it will happen. But at that time, medical science is always there.
Thank you, sir. Thanks for your advice to your society patients. And I hope once the patients will be seeing your advice, they will follow it. Thank you, sir, for coming.